Hi guys, today we are going to talk about management of anemia in pregnancy. So here you need to remember, if it is severe anemia, that is HB less than 7, you need to divide it into two groups. Number 1, HB less than 5 and HB between 5 to 6.9. So if it is less than 5, there has to be blood transfusion irrespective of the POG. POG can be any, maybe 32, 34, 36 weeks, but we need to give the patient blood transfusion. In the second option, we further divide it into two groups. If the POG is more than 34 weeks or if it is less than equal to 34 weeks. Now, if the POG is more than 34 weeks, we still give blood transfusion. Why? Because we don't have enough time that we see whether the oral or the parenteral iron are suiting the patients. Now, if the POG is less than or equal to 34 weeks, here we give parenteral iron. Now, the question arises, why don't we give oral iron? Because the rate of increase with oral and parenteral iron is the same. Because we don't have time to check for compliance. Here we cannot check the compliance for oral iron. That is why we are directly giving parenteral iron. So this is case number 1. Now when the hemoglobin is less than 7. Now if it is between 7 to 10.9, that is mild to moderate. HB between 7 to 10.9, mild to moderate anemia. Again, we divide it into two. POG less than 34 weeks, POG more than 34 weeks. So here we write POG more than 34 weeks and here we write POG less than equal to 34 weeks. If the POG is more than 34 weeks, we give parenteral iron. Same reason as earlier. If it is less than equal to 32 weeks, we give oral iron. And we repeat the HB after 1 month. Now, if the increase is more than equal to 1 gram percent in hemoglobin, then we continue the same treatment. If not, then we look for compliance. How do we check for compliance? We check for compliance by asking the patient for the color of stool. If she is taking iron tablet, the stool color has to be black. There can be other reasons of non-compliance as well, such as nausea, vomiting, constipation, then there is GI irritation, then there can be metallic taste. So if any of these is present, the patient might not be able to take the iron supplement consistently, and we then shift her to parenteral iron therapy. Now few things that you have to remember here are, number 1 is, okay, I'll write it here. Before giving this parenteral iron, we have to stop the oral iron. Why? Because oral can choke the iron receptors. And this extra parenteral that we are giving will be freely circulating in the blood and can cause toxicity. So this is very important that you have to remember. Now what is the dietary advice that you will give to the patient along with this? Pehla, avoid tea and coffee. Increase protein intake. Increase vitamin C, because vitamin C increases the absorption of iron. Then avoid calcium tabs along with it, and avoid antacids. Lastly, iron has to be taken empty stomach. Okay, there's a better absorption if it is taken empty stomach. But if she has GI irritation, if side effects or GI irritation is present, then she can take it after meals. Now, while we are talking about this, we shall also talk about the Anemia Mukt Bharat program. What does it say? For prevention, 1 IFA tab per day. 6 months during pregnancy and 6 months after delivery. Now, when should we start them? Start at 12 weeks. What is IFA tab now? IFA. This is iron plus folic acid. What is the dose? 60 milligram and 0.5 milligram. Now, which is the form of iron which is used here? It is a very important question. It is ferrous sulfate. Alright. For prevention, we give 1 IFA tab per day, and the second thing that we give here is deworming tablet. Deworming with tablet albendazole, 400 milligrams single dose, given in second trimester, any time in second trimester. What does it do? It can prevent hookworm infestation. Now, for prevention, you need to know about two things only: 1 IFA tablet and 1 deworming tablet. Few more pointers that you need to remember between IFA and calcium tab. Minimum 2-hour gap, because calcium interferes with the absorption of iron. Okay? As we've discussed earlier, we should avoid tea, coffee. So, do not take the medicine with tea, coffee, milk. Third, increase vitamin C because it increases absorption. Any other thing that you would like to tell her? Yes. Again, we're repeating the same thing. It has to be taken empty stomach. That's all for the day. See you in the next video.